The Consortium for Infant and Child Health, or people locally call CINCH, is a regional collaborative organization that focuses on children's health. And what makes us unique is that we don't just look at one neighborhood or one city. We look across the region and we think about how can we work together to improve children's health.
About 5 years ago, the YMCA decided that youth obesity was really an issue that we wanted to tackle. And we were looking for partners in the community on who might be the best for us to partner with. And at the time, EVMS is who we had decided to reach out to. And they put us in touch with Amy Paulson of CINCH. And so she came on board, and over a series of 5 years we got together, talked, we went through initiatives on how we can reach out to the kids in our community to make them healthier, related to movement and nutrition. And that's just one very small snippet of the kind of the partnerships that we've done over the years.
Amy is very passionate about what she does with CINCH. You can tell right off the bat when you meet her, and when Amy starts talking about children and their health care and what we can do as professionals and as just individuals to help the children in this area to improve their health, to live better lives. Amy is very passionate about that.
Part of what CINCH does to facilitate the infrastructure across the region is really to act as the cog in the wheel to bringing people together and helping them understand how they fit into a particular children's health issue. Lots of times we look at a children's health issue in isolation. We say, well, what's happening at daycare, or what's happening at school, or what's happening in public housing? And what CINCH does is bring all these partners together to look at an issue that impacts that child, where they go, where they live, where they learn, where they play, and bring them together to figure out how do we address this issue as the child moves throughout our community.
That's one area where Amy is so proficient in, because she has no boundaries. She doesn't look at one specific community and say, that's where I want to target our efforts. She really has never honed in on one particular part of a community that she wants to put all of her efforts in. And that's a real blessing, because it's hard to find someone that has that passion to really look out for the well-being of children in general, no matter where they live or what part of the population they come from.
She has provided me with a lot of enthusiasm for the goal that we're working towards together in this particular area to improve the health of children in this region. She's easily accessible. You can call Amy anytime. She offers her help pretty much 24 hours a day.
She really is the melting pot of bringing folks together from various entities throughout the community and in different facets. And I've been in several collaborative meetings where she's part of that. She brings us all together in a great positive way.
What makes me the proudest is when we come together and people realize that we can do more together than we can apart. There's value to partnership. We're not just the sum of our parts. You know, 1 + 1 when you're working collaboratively is 4, and 4 + 4 is 10. And there's real power in community. And being able to harness that power and help others to realize that when we harness that power, we can do amazing things.